Do you endure unexplained headaches or migraines? If yes, then you could have histamine intolerance.
What is histamine?
Histamine is a chemical associated with immune, digestive and central nervous system. As a neurotransmitter, it conveys important messages from your body to your brain. You might be familiar about histamine as it associates with the immune system. If you've endured seasonal allergies or food allergies, you may have noticed that antihistamine medications such as Allegra or Benadryl provide quick relief of your symptoms. Histamine causes your blood vessels to widen or dilate so that your white blood cells can quickly find and attack an infection. The histamine accumulation is what gives you a headache. This process is part of the body's natural immune response, but if you don't break down histamine correctly, you could develop what we call histamine intolerance. Typical symptoms of histamine intolerance include headaches, migraines, difficulty falling asleep, hypertension, vertigo, difficulty regulating body temperature, anxiety, nausea, vomiting, abdominal cramps, flushing, nasal congestion, abnormal menstrual cycle highs, fatigue and tissue swelling.
What causes high histamine levels?
Common causes of high histamine levels include digestive issues such as allergies, small intestinal bacterial overgrowth, SIBO, and increased intestinal permeability or leaky gut. Eating high histamine foods, poor breakdown of histamine.
How does the body break down histamine?
So histamine is broken down by an enzyme called diamine oxidase. If you are deficient in this enzyme, you likely have symptoms of histamine intolerance.
What are the causes of low diamine oxidase?
Causes include gluten sensitivity, leaky gut, small intestinal bacterial overgrowth, enzyme blocking foods including alcohol, energy drinks and tea, genetic mutations, gut inflammation from Crohn's, ulcerative colitis, medications such as non-steroidal anti-inflammatory drugs, antidepressants, immunosuppressants, beta blockers, antihistamines and antacids.
How do you test for histamine intolerance?
If you suspect that your headaches are the result of a histamine intolerance, the best way to test your theory is to eliminate all high histamine foods from your diet for a 3-week period and see if your symptoms improve. If your symptoms improve, then you can begin reintroducing foods one at a time to determine which ones provoke your symptoms.
How do you find the underlying cause of histamine intolerance?
If you're interested in finding out why you have histamine intolerance, then I recommend finding a local functional medicine practitioner or naturopath who is trained in root cause resolution medicine.